Good evening, good afternoon, and good morning. This is the 1734th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rohit Sharma. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same. You can share it with your friends without paying any money. And let me come to today's guest. As you all know, it is Dr. Rohit Sharma. He has completed BHMS and is a registered homeopath at College of Homeopaths, Ontario. He is running a clinic homeopathy and healthcare in Ebenezer Road, Canada. Has made more than he has more than 19 years of clinical experience. And Dr. Rohit Sharma has presented so many brilliant sessions in our forum, and he is a presenter nowadays, doing regularly some of the important topics connected with homeopathy. He is an expert in the field of treating pet animals as well as uh, uh, all those birds and that come on his way. We have an excellent presentation about all those things in the past. And today, Doctor will be talking about an important subject, that is stress, sleep, and mental health. Homeopathic role in emotional well-being. This is a very, very important thing. As you all know, that homeopathy is a system which is working on the basis of mental aspect. We are giving more importance to mind rather than physical general. So let us proudly invite Dr. Rohit Sharma for this presentation. Welcome, Doctor. Please unmute yourself. Your co-host. You can unmute. Please unmute. You're a co-host now.
Okay. Good morning. Good morning to all of you. Again, I'm very thankful to faculty of Ifph, who's regularly giving the platform to all the homeopaths, either they are experienced or they are freshers, to express their views and doing a great job for the society. It's a platform which is really helping. Even I'm helped a lot from this platform, as I have to prepare the lectures somewhere. Doing preparation of my lecture, I got some new concepts which I earlier I have shared, and today, even today, I will share something which I have learned while preparing this lecture. While it's it's important, it's a very important topic which I have taken today. So this is the topic given I have selected today. So I am Rohit Sharma, registered homeopath at Brampton, Canada. Earlier, I have served for more than 19 years, around 20 years in India at Patiala, Punjab. This webinar will tell you about how stress and sleep affects your mental health, how hormonal imbalances impact you, and also homeopathic rubrics will be shared related to the topic. In today's fast-paced world, stress, disturbed sleep, and emotional exhaustion have become all too common. These issues don't just affect our mood, they impact our physical health, relationship, and overall quality of the life. So it really affects your state of mind. Unfortunately, many people either ignore these signs or turn to the temporary fixes without addressing the root cause. Now, if we'll say about the stress, that what is the stress and how many types are there of the stress. Now we will go to the what is the stress. As I have shared this clip over the screen, stress is a physiological and psychological response to perceived challenges or threat characterized by mental or emotional strain from adverse or demanding circumstances. We can say the stresses of three types. It's acute, it's episodic, and third one is the chronic. Acute stress is a short-term reaction to immediate challenges like traffic jams. It can be beneficial by adding memory and learning through cortisol release. Second one is the episodic stress, is when frequent episodes of acute stress happens, often due to high pressure, lifestyle, or demanding jobs. It leads to elevate your heart rate, blood pressure, glucose level. It can develop into chronic stress if not managed. Now, the chronic stress, which is the third one, is the prolonged feeling of pressure. It's, it is prolonged feeling of pressure due to ongoing issues like hypertension, heart diseases, and anxiety. Common symptoms of the common causes of the stress are financial worries, loss of loved one, relationship issues, health problems, job stress, life changes, certain traumas. While we study, if we move further, the role of sleep. Sleep is very important aspect. Number of patients experienced that their sleep patterns are not proper. When we go into the depth and we ask that stress is the ultimate cause behind that sleeplessness or the sleep issues. Now, mental health and sleep go hand in hand. Good mental health help us manage stress, build relationship, and make daily decisions. But all of us is strongly influenced by how well we sleep. Poor sleep can lead to irritability, emotional instability, and difficulty, and mental issues like anxiety or depression often disrupt sleep in return. Quality sleep is not a luxury, it is a mental health tool. Getting enough restorative sleep, special REM sleep, is essential. During REM, which is rapid eye movement sleep, our brain processes emotions and strong memories. A lack of REM sleep can reduce our ability to handle emotions and increase risk of depression or suicidal thoughts. It's two-way relationship, not just a symptom. Traditionally, we thought sleep problems were just the symptoms of mental illness. But now research shows that it's a bi-directional relationship. Sleep problems can also trigger or worse mental health issues. Fixing sleep can help fixing the mind. I'm sharing a clip that how we can get the enough sleep. So I will not now go into the depth as the time is very short and the lecture is quite big, as the topic is very sensitive and it is not possible to complete the topic in one session. So here I will go with the role of homeopathy, how homeopathy is helpful in this case. Now, as we know that as we know that how the stress, the emotional instability, and your disturbed sleep, they are correlated, and how they reflect on our body. There are various symptoms which our body receives during the stress. And as a homeopath, we definitely go for the rubrics or the symptoms of the patient. We have to convert the symptoms of the stress of the patient into our rubrics. However, in the repertory, in the mind, total mind section in the Kent repertory, we have around 100 pages, and in synthesis repertory, we have 400 pages on the mind, reflecting the disturbed state. Even few rubrics are very positive rubrics, which I will not share today, as I will concentrate on the negative rubrics today, um, which often patient don't share. We have to search it out. We have to find which we have to find ourselves from the in the patient, because patient is not going on to share those negative things. Sometimes the patient don't feel the necessity to share those things, or sometimes there is a hesitation that should I share those rubrics or share those feelings with my physician or not. It's our duty, it's our responsibility, our reliability, and our face value, that how fast we present ourselves, like that patient share his or her feelings with us. So, the form of positive rubric, if we will say that benevolence, like benevolence is a positive rubric, but if it is there in the repertory, it means when it become a problem, benevolence become a problem, then we have to consider even that positive rubric. I remember a patient who came to me for a problem, and he came with his daughter. Her daughter told me that uh, guide him that he's such a benevolent person that he goes in the summer, in the full summer, in the market with bottles of petrol petrol in the scooter, and he's not under our control, he's doing such type of services. And then I call the uncle that his age was 70. I called him that why you do so. He told me that I have to help the people. Sometimes I have seen that someone get their bike out of petrol, their petrol is not there, so I keep petrol as well as the bottles of cold water. So I used to help those people, and I searched them. So at that point, her daughter was right, because he was 70 plus, and it was summer, 45-degree plus temperature in North India, and the uncle was going outside to found such people who were who have shortage of petrol, and the standing on the road. In that case, the benevolence rubric is very important, and it becomes negative rubric at that point. It doesn't mean that benevolence affects his emotional well-being. He was good while doing those things, but it was not a usual thing. We have to take that rubric at that time. So now I will go with the rubrics. I have some material with me which I have used clinically so many times, and while preparing this lecture I found some new rubrics which definitely I will use in the future. So when we go into the repertory, there is a wide section. There are numerous rubrics, but what I have seen that there is a particular section that is ailments from. Ailments from is a very big rubric, and it covers majority of rubrics which are responsible for producing the emotional instability, stress, and humiliation, and so many types of things which are responsible for ill health. And most important, the ailments from means whatever be the problems are there in the physical health. Either it may be headache, diabetic, hypertension, heart problem, or so and so. Sometimes it, most of the time I used to found it ailments from where it gets started and where what is the ultimate the root cause, because ailments from, like I will discuss all these things from you in front of you. Now the first rubric which I have studied, and I will say that almost I have shortlisted these rubrics, but I have somewhere used them. Most of the rubric I have used in the clinic. So the first rubric is ailments from abused after being. There are sub rubrics in this section. The first is children in, indignation with, marriage in, physically, sexually. Under sexuality there is some cross rubric, sub rubric, children in, rape, and violence from. Now in these 8 categories, ailments from what I have told, there are 1, 2, 3, 4, and 5, 6, 7. There are 8 categories, 8 rubrics, including sub rubric. Singular medicine was there, that was carcinosin. Earlier, during this my early practice, I was not using this medicine. But what I have seen that this medicine is very important medicine, is a very powerful sword, and clinically it is in so many rubrics. So while only the ailments from abuse being physically, there are 2 medicine, lysinum and carcinosin, but the rest of the symptoms, carcinosin alone was there. And there is a broad rubric that ailment from abused sexually, it carries 50 medicines. It's very hard that while we have a running clinic and we don't have some privacy, the patient will not share this particular feeling with you. So in children, how to find out that the person is abused sexually in the children? So it's an art, it is a task that we have to find out. Sometimes children don't share such things with their parents too. So sometimes it is not possible to direct ask these questions, but if your medicine is coming carcinosin on the other grounds, like the carcinosin dance very well, carcinosin knows the rhythm of the dance. So while you are sitting in a party, or you are sitting in a marriage, or you are sitting in a function, or you are sitting in a family function, you can feel that the particular person may be the carcinosin, because dance ability carries so many medicines. But to some people dance too well, they feel the rhythm of the songs too well, and they love to dance. And most importantly, sometimes you find those persons who love perfumes. So there is a rubric that loves perfumes. All these medicines, they have singular, or in the if singular carcinosin So while the person is, if we ask a child that what is your hobby, and their parents can tell that he dances so well, so you will find a thread that carcinosin could be the medicine. Then you can ask, or you can go softly into the thread that have you ever been abused or not. It's a very sensitive question, but you can go into the depth, because I have told so many rubrics their carcinosin is singular, but ailment from abused sexually carries 50 medicines. So it is applicable to adults too, young girls, boys, and everyone who is not a children. So even ailment from abuse being in marriage, it's a very important point that you can um, ask that in a marriage, if someone is sexually abused, then you have a singular option, that is carcinosin. So it doesn't mean that we will follow this singular rubric, singular choices. We have to go into the depth for the constitutional minimum, but I am sharing the things which are which we sometimes we don't know, or we miss, or we don't apply them in clinically. Now, moving forward, the rubric is ailment from reproaches. What is reproaches? Reproaches is when you feel light criticism, how you will feel clinically, that sometimes the grandparents or the parents came to you and they can say that our child, he doesn't have manners. Whenever he talk to me harshly, I get disturbed. So it is the manners which are not good disturbing you. So that is ailment from reproaches. It then ailment from anger with silent grief. It carries 50 medicines. Although from ailment from reproaches carries 50 medicines. These are the broad rubrics. Ailment from anger with silent grief. Very important rubric. Then ailments from bad news, ailment from business failure, ailment from care and worries, ailment from contradictions, ailment from death of loved one, ailment from deceived, ailments from discords between your chief and subordinate. So moving forward, ailment from excitement, emotional excitement, ailment from emotional excitement. Now there is a beautiful rubric that ailment from emotional excitement, emotional children, and certain movement. This I have discussed in details um, in the previous lecture. Ailment from money losing, ailment from homesickness, ailments from honor wounded, and ailments from love disappointment. Now, there is a rubric that is homesickness. Homesickness is seen in so many children's, young children's, the persons. There is a group of symptoms, a group of rubrics, if you will apply, that certain students, they leave their country, home country, and used to come in the foreign country for advanced education or the better future. What I have seen in them, a particular group of rubrics I have seen, that they are very ambitious. They feel homesickness, and they often get addicted to certain bad habits like alcoholism, or the you can say vape, like those things. So what do they, because their age is very low, they are very young, and they used to come in contact with the heavy stress. At that time they feel homesickness along with the other things. They most of the children, youngsters, they are highly ambitious, and when they saw that they are that it is not fulfilling their ambition, they get trapped into the wrong way. So this rubric, the children get emotional excitement at certain moments, money from losing, homesickness, and along with ambition increased or ambition deceived or ambition lost or ambition not fulfilled. When you will club all these things, so what I have seen that although I should not be biased with one medicine, but Nux vomica number of times has solved my cases because ambition increased plus bad effects of narcotics or the drugs. Number of patients they are on psychotropic drugs are there. So moving forward to the ailment from noise, ailment from rejected being, ailment from sexual humiliation, ailment from writing with the left hand suppression of. Sometimes someone is writing from the right from the birth, used to write from the left hand, then patient or teacher they ask him to leave the left side and to uh, uh, write with the right hand. This is a very big problem for the person. Then nowadays we found the rubric that in mind alcoholism, pregnancy, during and after. It's very common in abroad and it's very common in big cities that alcoholism during pregnancy and after. Why someone is taking alcohol? Because stress is the ultimate cause, that everyone knows that in this situation we don't have to take the alcohol. Another rubric is mind balance in life absent. I have not used this rubric, but definitely I will use this rubric in future. It carries so many medicines. Balance in life absent, it comes under the rubric consistency. Now, there is a practical symptom which we can see in the clinic, that mind grief sighing with. Someone takes sighing. What is sighing? Is this the person is in front of you and having a history of grief? It's a direct rubric that you can take or you can sideline. You can add on where you feel it is important or not from. Again, beside oneself being, this is a very good rubric. When beside oneself being, because due to your pain, anxiety, or so many things, when it is you can't control it, it is beside you. So biting, this is an abnormal symptom which we found regularly in the clinic. It is a response of stress or emotional instability, usually found in children, even in the animals. Breaking things. Now, our shopkeepers brothers or our businessmen friends or even whoever who is in business, there is a rubric mind businessman worn out, business suited to. And there is a exact rubric in journal which is businessman in worn out. Now the rubric which is in mind and the rubric which is in journal, both have the same feeling, that businessman worn out. It is suited to businessman who's worn out in the mind section. And in the journal, the rubric is businessman worn out ailments. So both seems to be normal, but else then the calcarea carb, all the medicine are different. So what usually I do, I usually take those two rubrics collectively, because we don't want to miss any group of medicine, any medicine. So these two medicines are two groups are there, two rubrics are there, but I usually collect those both. I don't take singular. Now moving forward, there is a rubric carest, desire to be carest. Now it seems to be positive, but all the times when a person want to be carest, how the other one can do this? Carest desire to be carest all the times, even by wet, children in. If we combine all these things, the pulsatilla is there. However, it is this session is for human beings, but what this rubric carries the weightage, that it is by all the time, even by wet children in. Means that all the human beings, all the animals, if they want that every time they need more and more and more love, the one medicine is common, that is pulsatilla. However, other medicines are there, but common medicine is pulsatilla. That how care that personality demands. Then comes the further one rubric, that is obsessive compulsive disorder, compelled to do the things at the same time. So this rubric I have used frequently, that is thoughts compelling. The medicines are under this rubric. Then there is anxiety to do something compelled to. This is related to the thoughts compelling, and checking twice or more must. Even this is a group of these three group of rubrics will definitely will not let you any remedy out, because I have already told you that I used to take all the symptoms collectively. I don't miss any rubric. I make a group of rubrics so that I should not miss the mice minimum. Along with later, I add physical symptoms journals too, because sometimes you can't understand the right mental symptoms, but the physical symptoms which are confirmed are I used to take. Don't miss those desire aversions along with that. Then moving forward, there is a rubric cruelty. Love to make people and animals suffer. Cruelty. If we'll see such person, you can see such things in the children. You can feel such things in the office. You can see such things on the street. You can. This symptom is not usually told to you by the patient. It will be. It will come in your reference through the persons who came with the patient. So this is cruelty, which is uh, on seeing, on hearing, can't bear. There is sub rubric. There is rubric cruelty who are cruel, and there is sub rubric that they can't see the cruelty. These are in children, in cinema, in television, in murder, and surgery. There is singular medicine again, carcinogen. So carcinogen is a very good medicine if you will go under the cruelty and you can't see the cruelty. Carcinogen is in all the medicines. However, there are other medicines too, but the common medicine is that. Now moving forward, the another rubric is brutality, which is higher form of cruelty, extreme cruelty. Along with that, then when we found such persons in youngsters, we found the cut, mutilate, desire to oneself. If you want to hurt yourself, to cut yourself, to mutilate yourself, there are 50 medicines, and it is commonly found in stressed person, in the students, in the youngsters, in the females when they are holding the household stress. There is another abnormal rubric, that is masochism and sadism. Masochism is the experience of pleasure, often sexual, derived from being subjected to pain and humiliation. And sadism is pleasurement derived from influencing pain on others. Masochism as when you want to feel the pain, you feel pleasure in that. While sadism is when you feel pleasure by doing good on other. And sometimes during stress we feel the presenting death. There is a rubric, death, presentiment of calmly things of death, usually found in very stressful patients. Along with, there is a rubric that societal disposition is a big rubric and it is known to all of you, but the death presentment of calmly the patient is thinking about the death. It carries so many medicines. Moving forward, there is deception. There is deception causing grief, deception causing humiliation. Now, moving forward, there is a rubric, drug desire. During stress, the patient usually take psychotropic drugs. There is a rubric, drug desire psychotropic. It carries 12 medicines, and if it is found in puberty in youngsters, there is only single medicine, that is Medorrhinum. I have solved one case by taking this rubric, that drug desire psychotropic. Psychotropic drugs are mainly medicines that influence mental state, emotions, well-being, behavior, used to treat depression, anxiety disorders. Moving forward, the rubric is envy. As you all know about the envy, but I will not discuss the envy here. There is another rubric which is down to envy, is envy and avidity, envy and hate, envy at qualifications of others. These are the cross rubrics. However, envy carries 50 medicines, but envy and avidity is a more worse version, carries a 14 medicine, and envy and hate is carrying 8 medicine. What is avidity? Avidity is the intense desire to achieve others' achievement. In envy, we feel that what other is possessing, we think that he's possessing, and you have thoughts. But avidity is intense desire to achieve that. So you have to differentiate between the envy and avidity. Now, moving forward, there is a rubric forgetfulness from emotions from. Another rubric is there forsaken feeling from not being loved by parents, wife, and friends. It is very important symptoms, and you will find it in your family or nearby friends. Even by patients, you can ask this question directly or indirectly, but this is a very important question. There is another rubric, mind insanity, stamping the feet. Stamping the feet is when you will stamping like this. You have to put your feet in that during stress. Sometimes these are the gestures. Now, very important, another rubric is mind gestures make. Sometimes one of my patient, he told me that her daughter used to do like this. This is all the time she used to like this. So this was a symptom. Repeating the same action. Now the gesture makes repeating same action, and under that, gestures make automatic sleep during. While you are sleeping and you are doing this and that, it carries only one medicine, that is phosphorus. However, it is not found in the routine, but I have treated one case with Sina, and there is gesture make involuntary motion of. Again, stamping of feet carries 40 medicines, that is sleep during. If you found it in children, you have 3 medicines. If you found it during talking, we have single medicine, that is Naxomica. So again, as we will go to the mind gestures make throwing about arms. What I have told you, that my patient told me that my daughter used to do like this, and I met him. I met her so many times. That girl. So I applied that rubric. Mind gesture makes throwing of arm. Sina is the medicine, and surprisingly, the child is very irritable and not consoled by anything. Typical feeling of Sina was when uh, I came to this medicine, then I club it, because she is my known's daughter, so it was not like a patient to me. So when I found this and prescribed Sina, now she's well, she's she's improved, she's not doing so. These are the rubrics which I have shared, which I have a number of rubrics which I have shared with you are from my uh, clinic. It is my clinical experience that I have received during my long work in Canada, in India. Now it's 11:38. So now I will discuss 2 short cases with you, and so the first case is this one. So this is the case that a young a, a young gentleman came to me for multiple problems. He said that I am depressed. I am on certain drugs which are antidepressant. I asked that he told me that he's totally negative. The whole aura of my house is negative. My mother is on antidepressant drugs. My father is diabetic. He said that whole scenario is the negative. I want to start my business. I want to make a company. I want to expand it. He was talking about the various books in which how to make money high, how to. He attended so many webinars, seminars to that how to gain your wealth, and I want to start my business. He told me, and I want to make a company and want to expand it fast. But my family is not agreed with me. So later he told me that he used to take alcohol, nicotine, and in the form of vape, and so many other things. Presently, he is in the psychotropic drugs, I can say that, antidepressant drugs. So what there were so many other symptoms which were related to that his physical state, that his heartbeat was increased, sleep disturbance was there, mood swings were there, headache was there. But I went I asked one thing he told me, that while driving on the road, it came to my mind that suddenly that I must turn my steering to the side. Then I asked him that you will lose your life or it will be an accident. But he told me that it is not under my control, but it comes so many times in my mind that I should do like this. So by studying the whole thing, I left the physical part, because when I studied that what is the abuse of alcohol, what is the abuse of nicotine, but surprisingly, when I put it that bad effect of nicotine, it was the whole physical, uh, his whole physical symptoms were belonging to those bad effects. So I left those symptoms, because I take the root cause from the journal that convalescence ailments during nicotine after abuse of. Now he is not taking the nicotine, but as we know that these things make a chronic stress, that what I have studied, we have discussed earlier that stress has three types. Out of that, the third one, chronic stress, lead to intake of nicotine, and it's all these physical symptoms are because of the nicotine. So I have taken the rubric mind, ambition increased. Number two, general convulsions and ailments, nicotine after abuse of. And third one is the drug desire, psychotropic drugs. These were the three main symptoms. Along with that, there were a symptom that he loves water, which he told me later, not on the same day, but he told me that I want to drive my car, I want to make the steering, but I have kept them those rubric on the side, because even I was not sure that kill desire to himself, sudden impulse will applicable or not. But water loves doesn't carry the nux vomica, but uh, I keep my I mean on ambition increased. However, ambition decreased, ambition deceived, because all carries a nux vomica. So I gave nux vomica to him, and on the next follow up, it was in my mind that I will not ask that how you feel. I will not ask. I ask a direct question to the patient, that you have a feeling that you want to make your steering to the side. How's that? You will be very surprised, and I was astonished that he told me that now that feeling is not there, and I drive my car very well, and I used to play the religious music. So it means that somewhere he is listening the religious music, and he's not having that mindset to turn the steering on that side. Nux vomica has helped. Later I asked the how you feel, then he told me my sleep is good, my REM, which we have discussed earlier, is good. However, little bit anxiety is there in the morning, but I am sure with time, or by raising the potency later on, we will definitely recover him. He will be recovered completely from this. Now I will discuss the second case. Now the second case is of a lady, which is surprisingly her mother. Now, is the boy get recovered or get ameliorated? He called that her mother is on antidepressant drugs. So I will let her. She will come with me on the next session or next. There will you must fix an appointment for her. And in this case, it's a very kind-hearted lady. She came in front of me, and for the first 20 or 30 minutes, he talked to me about his son. How is he? What happened to him? He's on drugs. He will be well or not? And my husband is on diabetic. He will be fine or not? I will let him also hear. What is this? it was careful of. I have taken this rubric from this discussion, that ailment from care and worries, because she came here in the early age. She was well qualified from her native country, but in the another country she has to work hard on the jobs which were not of their or of her level. So it was, and she has to care the husband, she has to care the his two children. However, every mother take care of the family, but when your husband, especially children, are not carrying the good health, the care and worries become increased. However, there is a very particular rubric is also available, that ailment from care and worries of a loved one, that carries cocculus and vanilla, but I have taken the bigger one, the ailment from care and worries. And the benevolent, she used to help the other persons too, out of the way she used to help in the native country and even in this country. She was on the antidepressant drug from 10 years. She has headache, she has constipation. So what other symptoms? She was very fastidious. Along with that, hurry. Everybody must hurry. Always she is in hurry. So again, her son and she, they both have the symptom that they love water. I asked them, do you love nature? They tell, no, we love water. We love to play in the water. We love to see the water. So there I searched and there was a rubric that water loves. But I would say that I will say that this rubric doesn't carry nux vomica, but I have taken this because it will help me to write to find out the another simillimum. If if the if nux vomica will not help, then nausea, riding carriage in it. The option were nux vomica, carcinosin, calcareous, phosphorus. These were my choices. I selected nux vomica as it was more close. She was the mother of the first patient where nux vomica helped. So I will nux vomica was given in this case. So another option was carcinosin, which loves calcareous carbon phosphorus, which loves water and rubric related to water. But I have not. I have kept it for the another simillimum if it was needed. So why the nux vomica was given? Because I have learned from a homeopath that what he used to do that he write down their physical complaints, he write down the physical complaints of your father, grandfather. He used to make a chart. Similarly, what I used to do, I used to take the mental symptoms of parents, children's, and the symptoms which are common in parents and children are my first priority. That these are the root causes which are genetically passed from their parents to children. So this is how I have completed my whole lecture. Now you can ask whatever be the queries related to case or any other discussion.
Thank you, Dr. Rohit Sharma. It's really a very good session indeed, and you really work on the subject very beautifully. That's the reason why you were able to pick up the rubrics and you were able to explain the rubrics in a beautiful way also. Anyway, this kind of discussion and this kind of presentations are really very good to understand what and how homeopathy medicine works in different conditions, and particularly the mental stress like that conditions. Oh, it's a time Dr. Sridhar Kurpu sir has already raised the hand. We welcome TN Sridhar Kurpu sir to this session. Sir, he was the former assistant director in CCRH Kottayam. So please unmute, sir.
As Dr. Rohit Sharma, it was a wonderful section regarding the rubric, mental rubric. It is very, you are explained very well. Of course, only 2 or 3 cases only you are shown, but it was very good. As a beginner, it is very good. We are getting maximum result in the mental disease, especially stress and other related diseases. Because as a person that more than 50 years experience, and also I worked in a mental institute, so I like to say it is a this class was very excellent session, especially rubric. It is very difficult to interpret the rubric. You are well done. Please come again. Thank you very much. Very good. Excellent.
Thank you, sir. And now I invite Dr. Indani Bhavadkar to say a few words.
Yeah. Sir, only one query I would like to ask Sharma, sir. Mental rubrics are very close to each other, and sometimes there is difficulty to compare them. I will give an example which our student has faced. There was a case of asthma 2 days back, and the case was taken thoroughly. It was studied on Mind Physical Journals. Next day, the patient had called, and he was a male of 55 years old. And on telephone, he told me that, sir, I've got a habit of handling my genitals, and this is for last 20 years. So this was an additional thing which he revealed next day. So in this case, which rubric should we take? Because the rubric came in mind was reveals secrets. That was one point next day. And second rubric was that naked desires to be. So how should we compare this? A student had asked me. So I would like to have your review for this.
He was having the problems of our genitals.
No, he was an asthmatic case, but the mentals revealed, many things. And the next day he gave a telephone call. It happens many times with patients. They call us afterwards, and they reveal their secrets to us on phone, not in front of us.
So what he has told, sir?
He told that he has got a 55 years old male. He told that he has got a habit at night of handling his genitalia for last 20 years. Second part, he told me on telephone. So we took it as revealing secrets as a mind symptom. So I would like to have your view for it. How should we take it?
As the voice is somewhere disturbing me. The first you have told me that he used to handle his genitals.
Yeah.
Exactly.
So, sir, it's rubric. It's a rubric in mind that you have.
Very true. It is a state rubric, and the drug comes hyosagmus. We have studied over it. One part, but sir, the thing is this. Next day he called up. He didn't reveal in front of all. And he told us telephone. So the mind symptom was very true that he wanted to hide from others what he wants to communicate.
Sir, basically, if I will, I think I will take it revealing secrets on the side, because it's a very sensitive point, and mostly children's, or even if I'm in the front of someone, I will not share it at once, because it's a trust issue sometimes. Because I will tell you that once I was suffering a lot from my chest problem, and I was having a backache. I was learning at that time at someone's clinic, and that sir who was the leading doctor was not there. His assistant, he told me with a laughing tone, and we don't have so much. He told me, you have to tell me your secrets, you have to tell me about yourself, so that I can treat you. So what I have done at that time, I have not taken from medicine from him, and I have taken whatever it comes to my mind, because I feel that that person is not able to handle me. He was, you have to told me. So it's a gesture sometimes that I have not shared, because I have trust issues with that. Sometimes patients feel that, is it okay to share with doctors or not? Is it is related, both are related or not? And sometimes at home, he feel that, no, if I have to be fine, I have to tell my physician. So revealing secrets, we can ask later that, do you keep other things private? So we will go, what I used to do, I used to go again in the depth, because once the thread is clear to you, then you will go into the depth to make it final, because sometimes if adding one rubric over the another will alter your minimum.
Okay.
Yes.
Secondly, sir, small query that in mind method means I am also following from many styroids also. Like belladonna, hyoscyamine, and stabonium. These are the leading remedies which all the time pop up in mind method when we approach. And Dr. Segar has said that 80% cases are belladonna by mind method. So I would like to have your views on it.
Sir, with due respects, I truly salute all the pioneers in homeopathy, but every homeopath has his own way. Like
Exactly.
I used to take all the symptoms together, whether it's physical, mental. So I'm not bound to any particular philosophy, and everyone should not be bound to particular mindset.
Okay, so boring questions approach. Very true. Very true.
Okay, okay. It's up
Thank
to
you, sir. Thank you, sir. Thank you, sir. Thank you.
okay, it's up to
Once
Dr.
a day,
Ranjana.
once a day, sir, a patient came to me and told me like this. मैं डॉक्टर साहब पागल हो गया हूँ वो मैंने पूछा what happened. He told me that I used to work on a call center and I used to do speakers on that. So what is that? I take a rubric ailment from noise, directly one rubric ailment from noise, because it was a noise for him, and there was a single medicine copulus in that, and that solved that case. So
Yes, sir.
it's the approach, sir. It's the approach.
Yes, Dr. Ranjana, you can speak.
Hi, sir. Good evening,
Good evening.
sir. Okay. First of all, I feel sorry that I couldn't able to join on time. Okay. So I just want to know that which repertory you are following, sir. Which repertory are you using?
Actually, I am using the synthesis repertory.
Okay. Or the rubric mentions are in the synthesis repertory itself, right? Yes. I think net connection is
Okay.
not available.
Okay, no, he's there, but some problem with the network.
Okay. Synthesis.
Yes, yes, Dr. Rohit is back. What was the question? Which room, which
Repertory that the doctors follow.
repertory?
Yeah.
There was
Synthesis.
Dr. Rohit, can you hear?
Basically, I use synthesis repertory because even I use Phatak repertory, but Phatak repertory references are given in the synthesis repertory. So synthesis repertory, Phatak repertory, and most importantly, the whole synthesis repertory is based on the Kent repertory. And I really salute and to Dr. Kent, who make a repertory, because in the student during student life, this was the most unfavorable subject for me to study the repertory. But now I think that I can't live without the repertory.
Okay,
Yeah.
thank you. Now I invite Dr. Rucha to say what are thanks to the session. Please unmute.
Myself, Dr. Rucha Mavadia, and I would like to extend my sincere gratitude to you, sir, Rohit sir, for such an enlightening and very wonderful and informative session, sir. And I personally could relate with this session very much, being an assistant professor in Department of Repertory, and the way you talked about rubrics and interpretation with real world scenarios and examples, it was wonderful, sir. Thank you so much, sir. Thank you so much, Rohit sir.
Thank you.
Thank you, Dr. Ruja. Tomorrow we will have a session from Dr. Ruja Mavadia, and we'll be talking about the importance of dreams and its interpretation while selecting a constitutional remedy with a case report. So the same kind of presentation we can expect from Dr. Subject is quite similar, and always there will be a case presentation too. So hope all of you will be joining the same time tomorrow with us. Thank you, Dr. Rohit Sharma, Dr. Teacher Sharma, and those who Rita Mavedia, and those who attend the session in this evening. Thank you all. Good night.
Thank you, sir.
Everyone.
Thank you, sir.
It's over to Dr. P. Shaila to moderate the Malayalam session now.